The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified health provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk.
Welcome. This is Birth, Baby. Your hosts are Sierra Morgan and Samantha Kelly. Sierra is a birth doula, hypnobirthing educator, and pediatric sleep consultant.
Samantha is a birth doula, childbirth educator, and lactation counselor. Join us as we guide you through your options for your pregnancy, birth, and postpartum journey. Thank you to our listeners for your continued support. If you enjoy our content, please be sure to like, follow, rate, and review wherever you listen to podcasts. This helps us gain visibility to other people that could benefit from listening in. Today, we are going to chat, just Samantha and I. It's just us two today for you coming into your ear holes because we are hearing so much confusion, or maybe not even confusion, just like not a whole lot of knowledge around the different midwifery models, different levels of care within midwifery. And I think if you choose the wrong one, you might be disappointed. So here we are to talk about what the heck that all means.
Yeah, I think this is an important conversation just because we hear a lot from people of like, well, I want to have a midwife birth. I want to have just this total physiological birth, hands off. I don't want monitoring. I don't want an IV. I don't want any of these things. But I feel like I'm going to be safest in a hospital. So I want to have my baby in a hospital. And that's kind of a tough place to be because can that happen? Absolutely. Sure. You can decline anything and everything. But that's not really what those systems are built for. You're not going to have a home birth in a hospital. And you're not going to have a hospital birth and a home birth. So I think kind of we just want to have a little bit of a discussion around your expectations and what these kind of different types of midwives can offer and can care for too, and what care with them looks like.
Yeah, I think an important distinction just to start out with is that there are CNMs and there are CPMs. CNM is certified nurse midwife, CPM is certified professional midwife, and then there are also kind of like the classically trained midwives where it's a thing passed down from generation to generation and they don't have like an official title. It's more of like a community midwife, or I'm missing the word there, but no matter what. And by the way, in some states, CPMs are not allowed to practice in home birth or not allowed to practice in hospital birth or whatever. There's all different rules, all different places. So checking out what the rules are in your area is important. But no matter what type of midwife it is, they all have safety standards and regulations that they have to go by. And usually that's based on the state or country that they're located in. So knowing that some of these things are quote unquote out of their hands because they're are regulatory agencies that are over them that are helping make those decisions for them.
Yeah, absolutely. Like in some states, you are not allowed to have a VBAC out of hospital, a vaginal birth after cesarean, or twins out of hospital, or a breech birth out of hospital. Like those things are just not allowed per state standards. And a midwife who was caught doing those things could potentially lose their license, which would then, lose their job, right? So that's why sometimes when you're like, well, I don't understand because the evidence doesn't support that. It's like, no, the evidence doesn't support that, but it's kind of just how it is, just by the state. And so setting your expectations and talking through like the why of things, I think is really important so that you're understanding why they're saying that these things are happening. But, also just understanding like, happy mom, happy baby, healthy mom, healthy baby. That is the standard of care, no matter where you are, home, birth center, hospital. Healthy mom, healthy baby is the absolute goal, and no one is going to be walking into a room without that goal.
Yeah. And then we also have levels up, right? Like physical safety, sure. But then, okay, in some of these places, we're going to have more mental safety. And that really depends on the parent that's going into that birth and their own things that they're coming in with, their own feelings, past traumas, things that they're working through, goals, whatever that looks like. So we're going to start with the most intervention of midwifery and then kind of work our way down to the most physiological. So let's start with hospital-based midwifery programs. And that looks different in different places. So I'll use Austin as an example. We have some hospitals that have hospital-based, like a hospitalist group, where if you come in from a home birth or a birth center transfer, or you're transferred from another hospital because this hospital has higher NICU level or whatever, if you don't have a provider, you come in and you go to the hospitalist, either OBs or midwives. And you can't have those people throughout your pregnancy, but they're there. Now, that is one. And then there's also one group in Austin called Moon Tower Midwifery that has birthing suites, like lower intervention birthing suites that you have to be super duper duper low risk to be able to be in. But even those rooms have rules. And I think it's important to know that these rules are not necessarily because this is what the midwives want. It's because the hospital has policies and these midwives have to answer to these hospital policies, abide by them in order to keep being able to function under the umbrella of the hospital. They know that they're not home births. They know they're not a birthing center. We actually called it a birthing center in the hospital one time. And they're like, don't call it that because it's a little bit of a misnomer because it's just not the same. And in that situation, you can still have individualized care offered, but only to a certain point. Because, for example, one of the things is like a marginal cord insertion, let's say. That may or may not be something you're allowed to go into a low intervention room somewhere with the midwifery care. Maybe you need to have continuous monitoring and be in a regular room. Is that going to be what's in these other ones we're going to talk about? No, it's not going to even be a thing that they think about. But because of hospital policy, it is. So a hospital-based midwifery system is best for families that either are too afraid, and that's okay. Like they have some past trauma, something happened to a friend or family member, their past birth went a certain way where they just don't feel comfortable being outside of a hospital system. No judgment. That is a great place for them to be because you can still have midwifery care in a hospital. Or you're too high risk to be at a birthing center or have a home birth. Let's say you have gestational diabetes that's not managed by diet and you have to have it controlled with insulin. Well, you can still have midwifery care in a hospital system, even in a regular room, with the midwives there. And that's wonderful. You want an epidural? You know for sure you want an epidural? Awesome. Have a birth in a hospital with a hospital-based midwifery program. That's a great choice for those people. So those are kind of the check boxes that those are or insurance, right? You're like, I am so bound by insurance and financially I cannot afford to pay for an out-of-hospital birth. It's not covered under my insurance program. Awesome. Have a baby in the hospital with one of these systems. Did I miss anything?
Yeah, I mean, I think it's just, I want to make it clear that in a hospital-based midwifery program, the buck is going to stop with hospital policy, which is almost always going to be based on liability and insurance. So liability and insurance has their threshold of comfort, way down here, whereas evidence says, well, it's kind of up here, but they want to take the most conservative approach to everything. So like with her example, with a marginal cord insertion, their standard would be, well, we want to have that birthing person on continuous monitoring just so that we can make sure that nothing potentially could come up that we don't see on a monitor. Whereas we know evidence doesn't really support that. But the hospital-based programs are going to have to follow that hospital policy. Now, does that mean that you as an individual can't say no to that? No. But it does mean that they have to offer it and that they have to make it clear that this is the hospital policy and this is why. Because that's just what their employer says,
You may have someone that respects that first no and awesome. Like you had to say no one time. You may have a nurse or a doctor or a midwife or someone who's rotating in because shift changed or someone's pushing in another room. So you got a new nurse and they're going to continually ask you again, remind you like that's not the safety standards. We're supposed to be monitoring you 24/7 and you keep having to say no. And the bummer there is that You're getting into a bit of that fight or flight, that conflict, that argumentative portion where you don't want to have to be there when you're in labor, and then that messes with other things. But remembering too that the why behind their hospital policies is almost always because we live in a litigious society. And one of the first things, if a midwife or a nurse or a doctor is brought on the stand, one of the first things that they're going to be asked is, the first evidence, we want to see what the strip looked like. What did the monitoring strip look like? Well, if you don't have that and we had an emergency situation, you don't have any proof that you were monitoring and that you were doing the quote unquote safest thing possible, blah, blah, blah. So knowing that it's not necessarily coming from a place of wanting to micromanage from a midwifery standpoint, it is they have rules that they have to live by in order to continue providing care for people in that atmosphere.
Yeah. Yeah. So then the second one we're going to talk about is birth centers. So birth centers, for anyone who is not familiar, is a freestanding system where there would be midwives. These could be certified nurse midwives or certified practical midwives, CPMs, and
professional.
Professional. Thank you. Professional.
I was thinking of the word.
I
saw you on that word go like, I think that was right.
Practical, whatever. They're practical people too. So birth centers are going to be just this freestanding place where you can go and have, something more similar to a home birth in a, separate place outside of your home. So a lot of people that are choosing to give birth in a birth center are choosing that because maybe they live too far from a hospital. So if a transfer became necessary, they would just want to be a little bit closer. Or maybe it's that they live in an apartment and they're just not really all that interested in their neighbors banging on the ceiling when they're, having waves and about to have a baby. Or maybe it's that they just feel safer there. They feel like they just want to be somewhere outside of their own home, in a place where maybe there's, other things nearby that look medical, and that makes them feel better. And that's totally acceptable as well. Those are all valid reasons to have a birth center birth. In birth centers, they also have to hold liability insurance. And then they also have to have policies just so that the midwives that are practicing there kind of have their standard of care of like, this is what our group does. And so they're going to have policies that can sometimes be a little bit looser than a hospital policy, and definitely can be more individualized to the person, but it is going to be this is what our birth center does. We don't accept, people who have gestational diabetes, for example. Some do, some don't, but that's just an example because that's just our standard.
Yeah. And it could be something like, some of these rules may seem kind of rigid, right? Like a BMI of exactly XYZ. And you're like, well, someone with a BMI of XYZ may be completely fine. And then someone else with that BMI may not be fine. So that doesn't really make sense. But because they have so many midwives working under them and they have to have this equal kind of experience for all of the people going there, that may be just something that they stick to a hard and fast rule. Whereas what we'll talk about in a minute with home birth, there's a little bit more, leniency or individualized care there.
Yeah, exactly. So you can have, a really wonderful physiological birth at a birth center. Both Sierra and I had our second babies at birth centers, and it was, pretty magical experiences for both of us. Birth centers are absolutely amazing, but there are, other things to consider too. Like, in a birth center, you're working with generally a group of midwives. So there might be individuals who practice one way and individuals who practice another way, or communicate in one way. And that can be a little bit of a jarring experience when you're talking to one midwife and they're like, yeah, we can do this, we can do that. Absolutely. And then you come to your next prenatal and they're like, no, you have to come in, as soon as your waters release, for example, or, whatever. So I think that I would say is probably one of the biggest differences from a birth center to a home birth is you're going to have a range of people and they're all going to be following a, specific policy in their own way.
It's like they have this umbrella policy that everyone has to abide by, but then you're allowed to be more strict if you want to. So that's where that hang up kind of gets. Like the policy of the birthing center might be that, I don't know. I'm like blanking on an example, but there could be a policy that they have, and it's still a little bit rigid. But then if a midwife wants to be more strict than that, they can. They just can't be more lenient than that. So that's where the hang up becomes like, well, shoot, I didn't get the midwife that was more in alignment with the way that I was thinking or feeling. And this is a little bit controversial. Some people like don't like what I'm about to say, but I'm going to say it because intervention in labor can be very simple. I'm not talking Pitocin. I'm talking literally stepping foot outside of your house is technically an intervention. That is the first step outside of what doesn't have to happen in order to have a baby. You don't have to walk out of your house in order to have a baby. So it's technically an intervention. And then that mental shift that your body and mind have to do in getting acclimated to a new place. So that happens whether you walk out and go to a birthing center, whether you walk out and go to a hospital. And I think another thing that I didn't mention in the hospital section, but I think is important and worth going back to is a lot of these hospital-based midwifery programs, you still need to go through triage, which is a little bit different than what you're going to do at a birthing center where you just walk into a room. Here, you're going to be at least 20 minutes in a triage room, and it's where everyone else goes. So that mind shift of like, oh, I am in a hospital, and then you get to go into a lower intervention birthing suite if that's where you're wanting to go and you're able to. That's a little bit different, and your body has to go through those changes and acclimations. And sometimes that can make your waves space out a little bit until they come back together again. And your mind is going through that. So that your hormones, go through that as well.
Yeah. Yeah, absolutely. And then we have home birth. I think that I'm always afraid that when people are listening to us talk about home birth, that they're going to think that that's just what we're championing all the time and that everyone should have a home birth. And I don't think that's true. I don't think everyone should have a home birth. I think there's definitely medical things that would preclude you from a home birth. But then I also think there's, just beliefs that people hold or feelings that people have that might make it so that one of those other options is a better option for you. But I think also one of the things that is really misunderstood about home births is that a home birth is just as safe as a birth center. Like they are going to have all of the tools at home that a birth center would have. The biggest difference is going to be the proximity to the hospital. And I think I can count on one hand the amount of times that I've had a quick, we got to go right now transfer from a home birth or a birth center. Really, it doesn't happen all that often.
I think I've had one in all of my birth. Yeah, it's so rare. And also what you're saying about the proximity being the safest, that's the difference between a home birth and a birthing center. Please, if you have not yet listened to our episode called Out of Hospital Birth, we did that with a midwife who used to be a birthing center midwife and now is a home birth midwife. And she gives really awesome examples of like the pros and cons of each of those systems. Please go listen to that because she talks a lot about the safety as well in that. And I think that is really important for people to realize. And it's the biggest hang up people have. And it's often partners. They for sure think somehow the birthing center is going to be safer than at home. And it's just not so.
Yeah, but it's, I understand it because for doctors and, what we see in society as kind of the standard for having a baby is you go into labor and you go somewhere. That's what we have been kind of conditioned to feel like. And so not going somewhere can sometimes feel unsafe to someone. If that's not something that you are able to kind of work through on your own, then yeah, you probably should go somewhere because in the long run, we want you to feel the safest to be the safest. But I think as far as, the difference in the care that someone is going to be offered, would be that in a home birth midwifery model, you are generally going to be working with, one midwife. Maybe sometimes you have a group of midwives that you're working with, but it's going to be a handful of people. And you are going to get to know those people. They're going to get to know you as an individual. They're going to, if you ever have had an intake with a home birth midwife, they're going to sit down. They're going to talk to you about your hopes and dreams and medical past and how your mom's birth went and how your sister's birth went and all of these different things to look at you as an individual. So we had a conversation with someone the other day that was talking about, well, I am 35, which makes me a geriatric pregnancy. If you've ever listened to this podcast before, you know how we feel about that term, but she would be considered a geriatric pregnancy. And so, with that, she was like, so am I at a higher risk of, different things going on? Would I not be able to have a home birth because of that? And we were just talking about, well, your midwife, when you go meet with a home birth midwife and have a consultation to see if it's a good fit, they're going to look at you as an individual, as a 35-year-old. And this individual is someone who works out a lot, who lives a very healthy lifestyle, who, has no medical indications that would mean that they would be at a higher risk. So them as a 35-year-old compared to someone else as a 35-year-old might be two totally different pictures. And I think that's the real advantage to midwifery care, is they can look at you as an individual. And in a home birth setting, they can look at you as an individual and follow, still following the state standards. They can kind of make their own decision based on you and your individual health history, and kind of go from there.
Yeah, that is really the biggest piece of it, because if your waters release at, and your waves haven't begun, then I've seen home birth midwives let that go 36, 48 hours before we're even worrying about it. Not worrying, but like even acting on it. Whereas a birthing center may have a hard and fast rule that if you're not in active labor by 36 hours, you have to go transfer to the hospital. And that's because of their liability insurance, right? And by the way, a lot of, I don't know if I should say this, but I'm going to, because I already started. And a lot of home birth midwives, especially in the state of Texas, like insurance is so freaking expensive that a lot of them can't even carry it. So they are based on state regulation, not necessarily having this insurance policy that's regulating them even further, even more strict. So they're allowed or able to be a little bit more lax, and hopefully not to the point of being, it doesn't mean that it's unsafe. It just means that they're not restricted arbitrarily by liability and potential litigation. Whereas in those other settings, they absolutely are. And that insurance is whether or not they're allowed to keep their doors open. Whereas a midwife, they don't really have to keep their doors open. Another really nice thing about home birth is sometimes those meetings are at your house. Those prenatal meetings are in your home. And some midwives do that, or at least 2 midwives I know of in Austin that always do them in your home. Some of them have like your 36-week appointment is in your home, and just at least so they can get a lay of the land. And then there are some that have an office and you come to all of your appointments there, or you can pay extra and change over to having some of those meetings be in your home. So just even that flexibility of not having to drive across town or to wherever to your appointments and being comfortable in your own space, especially for people with white coat syndrome. You can get, by the way, which means like when you're around a doctor or any sort of medical staff, your blood pressure rises and like your vitals are not as good. We've recently had somebody that happened to where even at the birthing center, they were having white coat syndrome. They had a blood pressure cuff at home. They would use it at home before they left the house. Her blood pressure was normal. They stopped to get gas halfway to the birthing center that was 50 minutes from their home. They took it again. It was slightly creeped up. They took it when they got there, before they even got out of the car at the birthing center, and it was exponentially higher. She had her first baby there. She liked her experience at the birthing center the first time. They were talking about hypertension with her, high blood pressure with her, and all of a sudden her blood pressure was crazy high every time she was going to the birthing center, and it was beautiful at home, and she could even go on long walks in the morning. So white coat syndrome is not just for doctors. Sometimes it's literally leaving your home and going to a place of any medical intervention. So if that's you, shoot, you might want to have your baby at home, because we can't fight. I mean, we can, but is it worth fighting the system when you're like, but I know it's fine at home, but they have their regulation where they're going to have to risk you out of care. You can't make them let you have a baby there, right? Like you can decline any interventions, but they can decline allowing you to have your baby there. And that's hard.
It is. I think that's that's one of the trickiest things is, you can't white knuckle your way into fighting a policy, especially out of hospital. So if that policy is there and if they're saying that it's not going to happen, it's not, you don't have to go get induced right away, but you can't have your baby there anymore. And that's a really tough pill to swallow.
And that's a little bit different than the hospital. You can say no to every policy and they're not allowed to kick you out. I don't think. I mean, they can't be like, you're in the middle of labor. They don't have to induce you. But if you come in spontaneous labor, they're not going to kick you to the curb. Right. So that is a little bit of the difference. So we just thought it was really important that we touch on this because in Facebook groups right now, we're seeing a ton of this, a ton of questions. Everyone wants to have their baby in a hospital with a midwifery system. And then they're getting really mad that they're not getting the typical midwifery care that they anticipated. Your appointments are still wonderful. They're still going over whole body health. They're still spending more time with you than you would with an OB. It's still far exceptionally individualized compared to most OBs, but it is not an out-of-hospital birth. It is not an individualized midwifery system as much so as you would get outside. So really think about what it is that you want and need and choose based on information and evidence versus fear. Education is the enemy of fear. So the more you educate yourself, and we hope to have been doing this in this podcast episode for you, the better decision you'll be able to make for yourself.
Yeah, absolutely. Look at your individual. I said individual, I think 30,000 times in this episode, but look at your individual wishes and figure out if the provider that you're with is going to match up to those. And if they're not, then maybe it's time to explore other options.
Yeah.
So,
all right, y'all. Thanks for listening.
For joining.
Talk to you soon.
Thank you for joining us on Birth, Baby. Thanks again to Longing for Orpheus for our music. You can look him up on Spotify. Remember to leave a review, share, and follow wherever you get your podcasts. See you next week.